When is heparin the answer on USMLE? There are 5 super high yield use cases you need to know, and I'm going to give you the exact vignettes they will give you so you never miss these questions on your exam. First use case I want you to memorize is pregnancy with thromboembolism. If a pregnant woman develops DVT or pulmonary embolism, what do you give? Low molecular weight heparin like enoxaparin, not warfarin, not direct oral anticoagulants. Why? Warfarin crosses the placenta and can cause nasal hypoplasia, stipple epiphysis, and CNS abnormalities. That's warfarin embryopathy. Direct oral anticoagulants cross the placenta too, and we don't have much safety data on them. But heparin is large. It's a negatively charged molecule that cannot cross the placenta, so the fetus never sees it. Some students will say, can I use heparin throughout the pregnancy? Yes, low molecular weight heparin for the whole pregnancy, but you need to switch to unfractioned heparin near delivery because unfractioned heparin is shorter acting and reversible if she needs emergency C-section. Second use case is acute coronary syndrome. If a patient presents with unstable angina or NSTEMI, you need to give them heparin as part of your antithrombotic regimen along with aspirin and P2Y112 inhibitors. During PCI, you use unfractioned heparin because it's titrable. You can follow prothrombin time, and if there's bleeding, you can reverse it immediately with protamine sulfate. Low molecular weight heparin is an option too, but unfractioned heparin gives you more control in the cath lab. Third use case is bridge therapy for surgery. If a patient on warfarin for atrial fibrillation needs surgery, you stop warfarin 5 days before, bridge with heparin or low molecular weight heparin while INR drops, hold heparin the morning of the surgery, then restart heparin post-op until warfarin reaches therapeutic INR. Why bridge? Because warfarin takes days to work and days to wear off, but heparin works immediately and clears quickly. Fourth use case is during dialysis. Hemodialysis requires anticoagulation to prevent clotting in the dialysis circuit. You use unfractioned heparin because you can give it, run the dialysis, and it clears quickly after the session, so the patient isn't anticoagulated when they go home. Fifth use case is initial treatment of acute pulmonary embolism or DVT. Patient comes in with a massive pulmonary embolism. You start heparin immediately while you're deciding on thrombolytics or arranging your interventions. Heparin prevents clot propagation while you figure out definitive management.